Hi everyone and welcome to our lecture 3. So I'm working on a new device and I can't get rid of myself sitting in the corner. I will fiddle with it later so you don't have to watch me the entire set of all the next lectures that I do. So this lecture we will start, as we have with others, with an acknowledgement of country. So I'd like to begin by acknowledging the traditional owners and custodians of the land on which we meet today, the Whadjuk people, and pay my respects to the elders past, present and future and emerging. I respect their cultural beliefs and the spiritual relationship with their country and recognise that these are still important to the Whadjuk people today. So our topic that we're very much focused on today is all about health and the information that we collect, how we collect it, what we're doing with it, and making sure that we have a clear understanding of our role as educators. So essentially, when we look at this health information, daily health information that we have, particularly in a childcare setting, it's how we look at the child's generalized health. And because we see them every day, we know whether they're okay, whether we need to be worried about them, whether we need to speak to their caregivers and so on. So teachers, they've got access to a really big amount of information. So we've got our daily observations, we've got their health records that you would have as part of their community health, together with potentially doctors, pediatricians and so on. You've got any of the health and developmental screenings that your school may take part in or your centre may take part in. And of course, you've always got input from the family. So as we talked about earlier in the first lecture in particular, information about a child's health is available in lots of forms and lots of sources. So we need to be really careful and we need to be critical about the resources that we use to evaluate it. So we want to think about our daily observations and how we can use those to our advantage. You've got potentially, especially if you're in a childcare, they have to have a complete physical form and immunisation record. So they're not allowed to access them without it. So that'll have things like their height, their weight, their BMI measurements, those sorts of things might be included. So we've got some controversy about some of those, so we'll discuss that a little bit more in the tutorial. But this idea of developing really good relationships with the caregivers means that we do get all that information in as many forms and as much detail as we require. So I want you to think really what needs to be available on a child's history form. So let's think about why and what we would want to have so that we knew what was going on with a child. So we've got things like recent medical assessments that we might want to have. We've obviously got the immunisation records. You'll want to have some emergency contacts of some sort. You want to ensure that you've got doctors and dentist details, potentially records of dental examinations, health insurance information if you do need to do an action of some sort. Most important is things like allergies, action plans for those allergies, or for an action plan for something like asthma and so on. You'll have some attendance data, anything that's happened to them previously in the centre or the school. You'll want to make sure that you have completed some documentation of any conferences regarding the child's health. If the centre or school has any screening results, they would be included. So all of those things form part of a child's history. We want to also consider any medications that the child may be on. Even if they are ongoing ones, they still need to be listed because they're part of what the child is taking every morning, even before they come into the centre sometimes. And we want to have authorisation to release the child to people other than the custodial parent. So with that health information, we want to think about how we're determining the child's current health status. We want to be able to then go through and think, okay, are there areas that we need to be monitoring in some way? So that way we can identify patterns. So one that I had was whenever this particular little girl came home from Dad's house, she was not bathed and fed and taken care of very well at Dad's house. She was at Mum's, but she wasn't at Dad's. And then I've had the reverse happen where they were taken really well care of, excellent, at Dad's because Dad shared a house with his mother. So it made sure that the child was really well taken care of. But then Mum, unfortunately, she was really suffering with lots of things going on in her life, and she just wasn't able to take very good care of the child's physical, emotional needs. So those sorts of patterns, really important. And sometimes schools and potentially childcare centres can even be asked to testify in court about some of these things, particularly if it's a custody agreement that's been breached of some sort, or they're trying to reach a custody agreement. So we want to look at generalised health information so we can work out a good intervention process. We want to make sure, if we are asking parents or caregivers to seek any additional therapies of any sort, things like speech therapy, occupational therapy, and so on, that we are carefully recording that we have asked them to seek that therapy, because again, a couple of years down the track, we're going to continue to ask for them and they'll go, "You didn't tell me that this was a problem." We often have this happen in year 1, when in kindy and pre-primary, the parents have been asked to seek additional help for hearing problems that the educators have noticed. And then it isn't until year 1, when the child's unable to differentiate sounds and they're doing a lot more reading and writing, that they're like, "Oh yeah, we might need to go and see someone about that. Why weren't we told about this?" And then you've got records to say, well, actually, we're told about it over the last couple of years, but we know that it may have been a tricky thing to understand. So making sure that you have enough information that you can coordinate services. You want to make sure, if you're talking to the child's speech therapist, which often as an educator you are, that you want to know that they're also seeing an audiologist for their hearing at the same time, and so on. And making sure for our health information that we can follow a child's progress. So when you're working in a childcare centre, if that child has been attending since they were, even before they were 1, potentially you could have 4 years of data about that student, that child in your care. And you may be wanting to conduct some action research and things like that that might be going on as well. So when it comes to our health observations and checks, so teachers, we really have that prime position to observe children, because we get to see them in relation to other children of the same age and expected development level. So we want to think that we have the potential to spot issues, good and bad, and that we can then talk to the caregivers about it. So we have a unique opportunity. So we need to think, how do we keep those records so that they are able to be accessed and used as required? Now, we really are obligated to make sure that we're protecting the health of all the other children. So if a child comes to a centre or a school with a potentially communicable disease, something that is highly contagious, could be dangerous for a particular child or two that are in the class with them, we need to make sure that we are not hampering the health of other students due to one child. So we want to take note of anything that's going on and to reduce the potential for exposure to other children. So finally, we want to make sure that good descriptive records are kept by the educators, because they are really helpful when we're evaluating what's going on. You must remember confidentiality with records. Some parents will want you to clarify what's going on with confidentiality and how anything is being communicated to different people and so on. So you must obtain consent if you're going to talk to anyone else about what your concerns are with that particular child. So parents need to know why and what's going on and so on. They have a right. And sometimes they get really concerned because of different things. So if there are visa agreements in place and so on, having diagnoses of different sorts can really impact on their ability to be able to stay in Australia. So we have to be really conscious of who we talk to about certain children. So why should we conduct our daily health checks? So this isn't just global, this is actually looking at our daily health checks. So daily health checks, they're a really important but informal screening tool. So we're looking at simple things like their appearance. We're looking at their behaviour and how they're acting. We're looking at things like rubbing, congestion, snotty noses, bruises of any sort, changes in behavior or temperament, changes to activity level, things like their alertness, whether they're cooperating with other kids. What's their appetite like? Has their sleep pattern changed? Do they have different toileting habits? Are they a bit cranky at the moment, a bit restless? So those daily health observations, they give us so much information about our child's well-being as well as their development. So we want to make sure that we get a good baseline of typical behaviour and appearances. We want to also note when changes start to occur. So if we're going to start to seek early intervention, we have to identify when did the issue become apparent, or has it always been apparent and we're now really taking note of it. So we want to conduct those checks. We want to make sure that we are recording down our information, and it should be done efficiently and accurately. You don't want it to take forever and so on. So we want to be really attuned to children's health and how we as the educators can prevent things, and if we can't prevent them, we can deal with them. So how do we conduct it? So you want to stop briefly, focus attention on the child. So it means that you don't just glance at them and go, oh, hi, Johnny, how are you? You want to stop, focus on them. I want you to think, how do you actively look at the child? So things like their hair, their eyes, their skin, changes in color, changes in, their shade of their skin. Are they very pale? You want to think, have they got a raspy tone to their voice? You want to observe with every part of you. So you want to be actively looking at them for any signs of illness or disease. Now, with COVID, this is becoming more and more apparent. You may need to scan temperature, all those sorts of things. You have to be then prepared to explain to the family member why you're a bit worried. So you might observe something and then say, oh, did they get a good sleep last night? And then the parent might say, oh my goodness, we were up all night. We got a brand new puppy and the puppy hasn't been sleeping. And so-and-so might be a little bit tired today. And you're like, oh, okay. Whereas if they were to say, oh, their little brother or sister's been throwing up all day and all night and we've been up with them and, we're a bit worried. And you're like, oh. So you want to pay attention to what the parents give as the reason for these things. So we want to always be observing and monitoring and communicating with the parents about it as well. So different centres will have something like a stop, look and listen approach, where they will have potentially a checklist like this that they have to fill in. So it could be just a tick, 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 or it could be a highlight things that you might be worried about. So it's dated and then it could be something that you fill in, or it could be as part of the app that is available. Different centres and different schools have apps where you can note these sorts of things down. So notes should be made immediately following the daily health check. Anyone who's had a lot to do with very young children knows that their health can go from okay to not okay really, really rapidly. Within an hour or two, they can be quite sick from looking just a little tiny bit peakish. Whereas as an adult, that could take 12 to 24 hours. With a little very young child, it's literally in a matter of 1 or 2 hours. So our health evaluation, it's important. Whether we're caring for infants or toddlers, we want to make sure that we are meeting all of their needs. So the teacher and child relationship means that we need to be aware of the children's health and their well-being, and also what we're going to do about it, because we don't want to have those difficult conversations with parents, but sometimes we need to. We need to make sure that every child is taken very good care of when they are in our care. So again, another type of checklist, and this just helps for educators to go, oh, okay, there's some things we need to take note of. So it might be that daily health checks, most things don't get ticked. You only tick the things that you're remotely worried about. So we want to think very carefully regarding vision and hearing problems. As the early years educator, particularly at a centre, you will be the first person that will be able to confidently recognise a vision or a hearing problem. Sometimes at home, the situations are so similar in their routines that the caregivers may not realize the children have a vision or a hearing problem. Oftentimes, vision only comes out in a center because you've got much more distance between one room to the other and they can't recognize or see certain things. And with their hearing, when there's lots of children in a room and they have to listen, but they're not responding to their name, an educator will notice that more than at home because mum's probably likely to be within their vision, and so the child will pick up on the non-verbals for it as well. So we get to see them functioning in lots of different situations, so we can see things like sensory issues as well. We can see things that are to do with coordination. So what we want to think about is anything that appears to give us concern of any sort. So children who are having a delay in speech because they're often going to be in the same room with developmentally similar children, you'll be able to recognize and notice when a child has very advanced language development or quite delayed language development, and you'll be able to see whether they're meeting the same developmental milestones in other areas as well. So it makes for a good collection of data, which can then lead to some really good conversations with the caregivers. Now, let's have a think about how we document those, because just like everything, we can notice all the things under the sun, but we have to make sure that we note them down in a way that can be useful as well as accessed appropriately. So at any point, we should make sure that we're making notes immediately following the daily health check or any of these observed behaviours that we see. Whatever we write down or include on an app or note against a child's data and so on, it has to be clear, specific and meaningful. So writing down that they appeared unsettled, it needs more clarification than just unsettled. You need to be very specific about the type of behaviour. So we want to make sure that whatever information we have builds up that ongoing picture. So you don't want to record a huge amount of information that becomes useless, but you do want to be able to track that growth and development over time. So any information that we take in any form that is written or shared even verbally, it has to be considered confidential, and we have to make sure that we're not using it to gossip about other children at any point. We are using that information to benefit the child and the caregivers. So only the information that affects a teacher's ability to work with that child needs to be shared with others. So if you are speaking with different therapists, different caregivers, different specialists and so on, you don't want to contravene the others' confidentiality about things. So make sure that you check what is okay to be shared with the parents, or check with the parents what's okay to be shared with the specialists that you might be negotiating with, and so on. Keep in mind, it sounds scary, but your records can be used in a court of law. So you need to be confident that you've included enough detail, but you haven't included too much detail that breaks confidentiality. So when we're thinking about this idea of referring children onto other agencies, we want to make sure that we've got more than one thing written down and more than a gut feeling about things. So you need to document those observations over a period of time and look for the patterns in them. So if you have concerns, you need to discuss it with the parents first. Then you can talk to them about a referral. Some things can be referred internally, so you may have a school psychologist on site, so therefore they could talk with them. You may have a occupational therapist and so on available to the school. So essentially, teachers should always refer the families to the right professionals and then support their efforts and help them to follow up if need be. So always make sure that you are supporting parents and not belittling them or making them feel a bit scared about what they're wanting their child to have access to. Because as I said, accessing referrals and acting on them can be really, really confronting and stressful for parents. So always keep in mind that you rattling off the top that you're a bit worried and their child's going to need speech therapy and you're fairly sure they've got a hearing problem, that could be traumatic and horrendous for the parents to hear that. So just be aware of your impact when you're talking about these things. It's not to say downplay it and don't do it, but just be aware of the impact of your words. Now, there's always a line between what childcare and educators do and what parents do. Keep in mind, primary responsibility for a child's health always rests with the family. Now, we might ask and request that the family seek professional assistance in whichever field, but we have to respect if they don't do that. Now, sometimes parents don't want to acknowledge the child has a problem. Sometimes they genuinely don't believe they do. They think the school is just being dramatic and that they don't need to worry about those particular things. And sometimes that's why it takes a few years for them to seek additional help. Some parents will have other family members or friends saying, oh, don't worry about them. They'll learn to talk when they're ready. They'll learn to do this when they're ready. It'll be fine. And that's okay, but it doesn't help because you are the person with the education to know that a stutter, for example, children do not grow out of a stutter. It only gets worse. They need intervention from speech therapists to deal with a stutter. If a child is not walking by 18 months, it's not the worst thing in the world, but we need to work out why. So most children, 90% plus, are walking by 18 months. If a child is not forming lots and lots of words by the time they're 18 months to 2 years old, that's a problem. So we often see parents delaying things because they're being told by other people. So it is also traumatic to acknowledge there's something wrong with your beloved baby. So some parents do often delay for a year or two till they can make peace with the potential diagnosis. And quite often the parents do know what the diagnosis will be. They're just scared. They know that it will require lots and lots of effort, and they go through a grieving process for their child's potential that now is being snuffed out. Because when you get a diagnosis of something that is a lifelong condition that doesn't go away, it is quite a smack for you that you have to get back up from because you have been knocked down. So some parents resist that process for a number of times. Now, be aware, they may also go through wacky-do things when you start talking to them about it. So the ones, my favourites, they go and seek lots of alternative treatments because this person will help them with whatever is the problem. If they go to a chiropractor and do this and this, if they go to this specialist that has no acknowledged medical degree, then it'll magically fix up their speech problems. And all of those things, they often seek different treatments. They potentially could be quite angry at you and they will vent their anger at you, so be aware of that. They could regress, the parents, and stop speaking to you. So they're experiencing emotional turmoil of some sort. I have some of them who've said, I'm so sorry, my child is here, I'm so sorry you have to deal with that. And you're like, I'm just the teacher. You're their parent. You're the person who has to go through more than me. I only have them for this amount of time. And so some parents will also get really, really depressed. Please keep an eye on them because it can be it's really, really traumatic receiving a lifelong diagnosis. And finally, they might reach a bit of a guarded acceptance with things, but that takes a long time and it might not happen for another 2 or 3 years. So as they move their way through those sort of sub-stages of grief and determining their new lives, they just need more support. So you want to make sure that you are supporting them and that you are giving them as much information as you can about certain things. Now, we have to tread a careful line as educators We can't insist that children receive treatment for their health problems because parents make those decisions. We can suggest, we can provide lots of information, but we can't insist. And we certainly can't go over their heads to get treatment in a different way. But we just have to make sure that we're providing as many support mechanisms as possible. So let's think about what we can do now from a proactive and positive way. So when we're thinking about how we do the health checks, we're checking for problems. What we want to do is to move the other way to think, how do we help parents to understand what they can do to promote a healthy lifestyle? So things like encouraging the children to have a healthy breakfast before they come into the centre or school. Making sure we provide lots of healthy snacks, and that if the parents are providing things, that they do as well. Have open discussions. Every parent night that I've ever run with my early years, we're always talking about what are good foods and what are occasional foods to send in their lunch boxes. I am never an educator who says a child cannot have a piece of chocolate cake or a muffin or a little chocolate bar or something like that. However, on the converse, I have had children come along with entire family blocks of chocolate that has been wrapped up and popped back in their bag and said, probably not the best to bring to school. I have had children turn up with only a bag of crisps for lunch. That was something that I needed to ring up. And I've had children turn up with cans of soft drink, and I've even had one turn up with a can of Red Bull that got popped back in his bag, and a little phone call home to mum to explain that that was not the best for their child. So you want to talk openly about foods and their nutritional value, but please don't always think you have to stop them having it. You're not to know that that child has begged for that treat in the morning, or that the child had to go through something horrible in the morning, and that was kind of like the reward that they had for whatever that went on. So think about what your policy is going to be regarding food, and we'll talk more about that over the next couple of weeks as well. So think how you can promote a healthy lifestyle by integrating this idea of your literacy and nutritional. So looking at the values of things, reading packets and so on. I love to get the kids involved making. So we used to do baking or cooking. It wasn't just baking. We used to do cooking every single week when I had the kindy kids. Once a week we would make something, and we would bake, and we would talk about different foods and let them have experiences. I always provided parents with lots of information about potential lunchbox snacks when I had kindies and pre-primaries, because sometimes parents, oh my goodness, the things that are on Instagram, who has the time for those things? So just make sure parents have lots of information about things they can put in, and help the families to understand what some good healthy eating practices are. Screen time? Yes. I always help parents to understand what is appropriate screen time and what isn't, and how they can make sure as part of their lifestyle that they have a good balance, particularly with the next point, which is about exercise. And finally, to make sure that parents are a good role model, but also that you as an educator are a good role model. A lot of centres and schools have a rule of no soft drinks being allowed in visible lines of sight to the children. So if you're going to have a Coke, it has to be in a mug that the children can't see. So even this morning, I was out at a school and I had, my cup of tea that I have. And one of the children said to me, "What's in that?" And I said, "Oh, it's my tea." And they went, "Oh, I thought it was coffee, and you're not supposed to have lots of coffee." And I said, No, it's tea. And I said, "Sometimes I have black tea, sometimes I have green tea, sometimes I have herb tea." And they went, "Oh, okay." And they were just happy with that. So remember, you are always a role model when you are an educator. So to see you constantly holding a soft drink or a caffeinated drink or a drink full of fruit juice, even full of sugar and so on, yet we're asking them not to provide those in the centre or the school. Yeah, we want to make sure that we are being good role models all the time. So think about what you can do and how you can build all of these ideas of a healthy lifestyle by providing lots of school and community physical and emotional health events. Sorry, I've just realised I've got a really bad spelling mistake with bike. Education instead of education. So there are community outreach organisations. There's things like the health education van. We want to have activities around sports carnivals, fairs and fetes and parent sessions, things like Jump Rope for Heart, Red Nose Day, Jeans for Jeans, Bike Education Week, setting up veggie gardens. I always had gardens that were just near the classroom where possible, and we would plant fruits and vegetables. We would make sure the children had access to be able to see them grow and so on. So being active that way, making sure that you have lots of different opportunities for the kids at the school and the wider community to work together to build positive attitudes towards our healthy lifestyles. So making sure that our teaching and education staff understand that you are absolutely important in the prevention and the protection of health, that pre-employment physical examination meet health record requirements. As teachers, you have to be fit for work with the TRB. So it means that you have to be able to be physically able to do your job. If you do any work on the mines, you know that you have blood and drug and alcohol screening tests done before you're allowed on site. If you are a truck driver, you get regular screens for drugs and alcohol as well. So as a teacher and staff, you want to make sure that you have good health. So keep up to date with your immunisations. Make sure that you follow good hygiene practices. Make sure that you are protecting yourself and that you're staying home when necessary when you are ill so that you're not transmitting things. Don't drag yourself to school or to the centre just because you think you should and so on. So make sure also as an educator that you are doing things to avoid stress. Think about your back. So lifting, moving, doing all those things. We have a lot of childcare and early years educators who suffer from bad backs because we're bending down constantly. So bend with your knees, and that way you are still meeting the child rather than bending with your back. Always consider hazardous environmental materials. So think about the materials that you clean with, what you are doing, because everything that we think is hazardous obviously is going to be hazardous for the small children that we're working with as well. So make sure you're always considering those things. Now, in summary, we as educators must make sure that taking care of children's health and their needs, it's part of our everyday practice for all of our early childhood educators. Our daily health checks for the children, it should be part of a natural process that we have in our childcare centres in particular. For our kindy and pre-primaries, I think you'll find it easier. You've got them all day. It's a bit easier. Childcare, you're often running around and you might have more children and there's more educators and so on. So really think, what is your daily health check process that you're going to put in place? So recognise the early signs of different health conditions and arrange for some early intervention if necessary. But remember that families, they hold the power with this, and it's their responsibility for maintaining their health, and you must chat with them about things. In terms of our impact, we can make contributions. We can make sure that we've got possibly some on-site healthcare. Lots of schools have the dental van that comes around. Lots of schools have various education things. We make sure that our learning environments that we create are nice and safe. We make sure in a centre that we're providing good, nutritious meals. So we do as much as we can, and then we want to work with the families as well. So, in our tutorial, we have a case study that we're going to look at. We're going to investigate some different screening tests. We're going to look at what a daily health check could look like and how we do it. And of course, we have our first quiz. So make sure that you have done your readings, kept up to date with things, and then you're able to answer those quizzes. All right, thanks everyone. I will talk to you in class.